Hi, everybody. Thank you. We're just going to give people a moment to join us. Welcome to the October RDLA webinar. I always talk really slow at the beginning of these to give people a moment to join us. So it's not your Zoom link, it's just me. I'm Annie Kennedy. I'm the Chief of Policy Advocacy and Patient Engagement at the RDLA Foundation, and we thank you for being here with us today. I'm really excited for today because we have some really wonderful friends and colleagues who've joined us for, we're going to do a little future casting. We asked them all to bring their crystal balls along to navigate this conversation with us. And we were sort of in the virtual green room saying that we probably should reconvene this conversation again in November and come back and see where we landed. But we're going to ask everyone to do a little bit of speculating about the coming weeks and months and talk about what could happen based on the upcoming election and how, as a community and as rare disease community advocates, we can optimize our opportunities over the coming weeks and months. So if we could have the next slide. If you would prefer to be calling in today, the phone numbers and webinar ID are posted here. If you would like to ask a question today, we ask that you put it in the Q&A box, not into the chat, so that we can ask some of the speakers and navigate that. Today is not going to be slide presentations. Today is a discussion. So hopefully this will be fun to listen to, and we're going to try and keep it casual. And if you are a member of the media, we would like to know that you're here. We welcome you, but we want to know that you're here. So we ask that you let us know. Okay, next. We do, as always, have closed captioning. So this is information about how to participate in the closed captioning. We also have real-time Spanish translation services available. So there's information here about how to click on the link. And Alyssa's activating all of that right now so that you can be participating in Spanish to our conversation. All right, next. Okay, I'm going to introduce everybody and read amended versions of everybody's bios because everyone here is an incredibly accomplished, esteemed member of our rare disease and community and have had really wonderful careers in policy and legislative leadership. So we're really grateful to have them here today. But just some highlights so that we have some context for the conversation. So I'm actually going to start with Cheryl, who thinks Cheryl is jumping into the deep end. She just joined us. Cheryl Yeager joined Williams & Jensen as a principal in 2014. She's a dynamic and strategic policy advisor who's had 2 decades of experience delivering legislative victories and developing policy agendas. She brings an extensive healthcare background to her firm, having served 15 years on Capitol Hill, including 9 as a senior health policy advisor for the House Republican leadership team, most recently working with former House Majority Leader Eric Cantor. In this role, she led the advancement of healthcare reform legislation to improve patient choice, lower healthcare costs, and expand innovation. She has a very long background in many other roles on the Hill, but she has also been recognized as a leader in the rare disease space with a Rare Voice Award in 2014, and also serves on the National Advisory Board of the Johns Hopkins Sidney Kimmel Research Cancer Center. Eric Gashko, Eric, who also gets a shout out because he's leading one of their annual conferences for the National Health Council today and has stepped away to join us today, is a Senior Vice President, Policy and Government Affairs for the National Health Council. He's been with NHC since August of 2009. In his role, Eric leads the National Health Council's advocacy efforts by working with its member organizations to develop policy positions that seek to improve the lives of people with chronic diseases and disabilities, and advocating for these policies on Capitol Hill and within the executive branch. He also represents the NHC in national media, the broader healthcare community through public speaking engagements and in coalitions. He serves on the steering committee of the Partnership to Protect Coverage and the NIH's PCOR Chronic Conditions Monitoring Board. Prior to joining NHC, he worked in the Government Relations Department of the Society of Teachers of Family Medicine and is a really wonderful partner of the RDLA Foundation and many of our other partners. Jennifer Bernstein, and Jen, if you could indicate, joined Horizon Government Affairs in 2008, where she concentrates on legislative and regulatory issues within the biopharmaceutical landscape. Under that broad umbrella, Jen focuses on policy issues that impact the rare disease community, educating patients and their families about policy and advocacy. That is something that Jennifer is extremely passionate about. She's a firm believer that people impacted by a rare disease are their own best advocates, and she enjoys empowering others to find their voice and navigate the legislative and regulatory process to bring about needed change. Prior to joining Horizon Government Affairs, Jennifer worked on Capitol Hill. Additionally, she spent several years as a healthcare analyst for a boutique investment firm. She's a world-class killer of houseplants, a super fan of Rage Against the Machine, and her kids have crowned her the world's okayest mom. I really enjoyed that, Jen. Darren Watts is the founder of the Watts Group, practicing at the crossroads of law and public policy, providing strategic counsel to clients facing complex challenges involving government regulation, public policy, and politics. Darren was a partner at Sidley Austin, a leading global law firm where he practiced for more than 23 years in the global life sciences practice and co-led the firm's government strategies practice prior to founding the Watts Group. In 2018, he founded TWG to continue providing the same elite law firm services his clients expect, with the flexibility and value of his own boutique firm on issues ranging from straightforward legal or policy matters to complex issues involving law, policy, and political issues. Darren serves on boards of the Congressional Black Caucus, TAC, and the University of Southern California Gould School of Law, as well as the Corporate Advisory Council of the CVC Foundation, and volunteers his time to help on caucuses such as social and racial justice, health equity, and voting rights. As you can see, we're very fortunate to have all of these wonderful leaders here with us today to really help us think about how we will be navigating and optimizing our time in the coming weeks. So I just want to, first of all, personally thank you guys for joining us. So Alyssa, if we could pull down the slides so we could see each other. So I think one of the things we wanted to do, and those of us on this panel have spent some time back and forth sort of talking about how we would approach this session. So as everybody knows, there is an election coming up on November 8th. So I think the first thing is we want to make sure everyone votes and engages and participates in the election. But maybe so we're going to talk about two things. We're going to talk about what potentially could be the outlook between now and year end and how to optimize our engagement with Congress in 2022. And then we're going to pivot and talk a little bit about 2023. So maybe what we could do is if I can ask Jennifer to get us started and give us a sense of what the end of 2022 looks like as far as productivity and timing on the Hill. How much time are we talking about we have as far as engagement with members of Congress?
I want to stress, don't take notes on anything that I say, because everything that I tell you could very likely change. So I feel like a little bit of a weather forecaster where I might be right, but I'm probably not. And that's just the nature of the beast right now. So what happens for the rest of this year? Let's start with, to explain what happens going forward, let me just back up a bit and remind everybody that the user fee package that was passed at the end of September, right at the end of the fiscal year, actually was clean for like the first time that I can remember. And so that means that all of the policies that were added on to the legislation that were outside the scope of the agreement between industry and FDA essentially fell out of the bill. I've never seen this happen before, but I got to say the last couple of years, I've seen lots of things that I never thought I'd ever see. So it's sort of par for the course. But it's important to note that even though a lot of the policies that we were tracking did not move with the user fee agreement, that doesn't mean that they're not going to move at all. And so this brings me to, like what to look at heading into the end of the year. So the four corners, so that means basically the Republican and Democratic leadership in both the Energy and Commerce Committee and the Senate Help Committee have said very publicly that they want to continue to work with each other to see how to move some policies forward heading into the end of this calendar year. So things that were left off of the user fee bill, like the Prevent Act, which came out of the HELP committee, and it's a pandemic preparedness related bill. There's Cures 2.0, which our friend Mr. Upton and Ms. Degat have. Those types of things are sort of still spinning around out there and could potentially see some movement at the end of the year in a end of year package, as we're calling it. Just as a refresher of what's in Cures 2.0, I mean, there's a lot to unpack with it. There's digital health regulation, there's innovative clinical trial designs, there's gene and cell therapy regulation, there's real world evidence. So there's a lot in there. And I just want to caution that, you know, maybe only some of it moves. Maybe all of it moves, or maybe none of it moves. Really don't know. But just to keep an eye on those particular pieces of legislation. The other piece that I'm watching is actually the Accelerated Approval Integrity Act that Chairman Pallone is very intent on moving, and that would create some changes to the accelerated approval process. And not to get too into the weeds with those on this call, but it's something that we need to be watching in this particular community. And so that's something that we could see move on an end of year bill as well. And then going beyond the user fee riders, there's also, you know, other healthcare issues that go sort of beyond these FDA provisions that I just mentioned. There's mental health legislation that I think could very likely move. There's expansion of telehealth flexibilities that go beyond the COVID public health emergency. There could be some Medicare cuts, and again, not to get into the weeds on all of these things, but there are a lot of other cats and dogs that are in the mix on top of the user fee riders. And having said all of that, it's important to note that the ability for any of these things to move really is going to depend on CBO scores. And CBO, from what I understand, has been given a list of items to score, including most of everything that I just mentioned and a lot of other things. And the ability to move forward on some of these policies is really going to depend on what those scores are, and then any offsets, which are going to be slim. So I don't know, I feel like I just threw a lot at you, and it probably doesn't make a lot of sense. To boil it down, there will be a big end of year bill.
Pause? Jennifer, can I ask you to pause for 1 second? So before we go any further, I just want to clarify for people what a CBO score is and what an offset is. So can we dig through that just a second? And then, and anyone here can tag in, so you don't feel like you're having to do all the education. But for those, the CBO is a Congressional Budget Office. We don't expect that everyone knows all the acronyms in DC. So, and that bills are scored, or there's a budget impact assessed for any bills. Anyone here in the community that's worked on a piece of legislation knows that if you go to the Hill and you talk to a staff or a member, they always ask, has this been scored? And essentially they're asking what the budget impact of moving this legislation forward might be. How much would it cost, essentially? And,
or save.
or save. And so that's what Jennifer is referring to, is the score, or the budgetary impact that that might have.
So yeah, anything that costs money needs to be offset. So if you're going to spend some in column A, you're going to have to take some out of column B to cover that cost. It's basically like balancing a checkbook. Does anybody even use those anymore? I just dated myself, but you understand what I'm saying, is that if you're going to spend the money, it's going to have to be captured from someplace. You can't just, well, you can, but you're not supposed to just, you know, write checks that you can't cover. So the CBO scoring process is going on now. They're working on these scores, and I suspect that these will start to trickle out once members are back in town from recess.
Awesome, thank you. So before we go any further, because that was a lot, and I think we should spend a little time unpacking that all together. Does somebody want to comment on, and maybe Cheryl, you can comment on, what's our actual timeline? So I know we all look at our calendars, we're like, great, it's October. And so that means we have, November, December, and half of October to go. So we have lots of weeks left to get a lot of this done. What's the actual timeline where there are days of productivity on the Hill to actually be working on some of this?
Happy to jump in here. And Jen did a really great overview of the healthcare provisions. I just want to mention to everybody, just for perspective, technically this Congress only has one must-pass bill that needs to be completed, and that is the appropriations process. They can do that in a big bill that funds all of the agencies, or they can do it in smaller bills or what's called a continuing resolution to continue the funding. But that is the only one that is technically required to be done, although members with priorities think all of their bills are required to be done. But I raised that for you because we do not have a lot of time left for Annie's question in the year. And in fact, it's much shorter than you would think. Here we are on October 20th. The new Congress has to be sworn in the beginning of January constitutionally. You cannot go over this Congress. So they have to conclude before the new Congress in a lame duck session. The issue right now is how much are they negotiating, right now? And I can tell you the answer is very little. And the reason is both parties are trying to position for this lame duck session their top priorities and what makes political sense to them to move before the end of the year, or what makes a bigger win if they take the policy issue into the next Congress. And those decisions between the two parties truly can't be made until they see what the voters decide on November 8th. And when the voters decide, it's who's going to be in control of the House and the Senate, and by what margins. Are we going to have a very divided Senate still? Are we going to have right now, Speaker Pelosi is in the majority by only 4 seats. If the Republicans, as some of the pollsters and press are reporting, do take back the House, how big is his governing majority? Is he going to have a small margin like Pelosi does, or is he going to have, 30 vote margin? It's a big open question right now. And depending on those governing margins for both parties, they're going to make some decisions where they want to, the term we use in DC is clear the deck. They want to clear the deck of some policies, or they want other issues to carry on into the next Congress, even though, just for you all to know, when you have a brand new Congress, you have to start every piece of legislation from scratch. And so the debate or the conversation on the policy continues into the next Congress, but the actual process and technicality of introducing legislation starts all over, brand new, and lots of new leadership from new committee chairmen in the next Congress, which will change agendas, which is part of the decision making here for what could potentially go before the end of the year. So lots of things in play, and lots of retiring members who want legacy items, which also plays into all of this end of year. But Annie, boil it down. How many weeks do we really have? You have about 6 weeks max after the election to get everything.
We got it. It's stressing me out, just like shopping for the holidays. Like
6 weeks max.
Eric, I saw you unmuting. Jump in. This is like a fun Sunday morning talk show. Go.
Yeah, we're the round table panel, right?
Yeah.
Yeah, just adding on a couple of things just to put an actual date on that as well. The appropriations bill has to be passed by December 16th. So that's sort of the deadline that we're looking at for a lot of these potential things that Jen laid out to potentially be included. The one other thing that I'll sort of add that is kind of weighing in the minds of leadership is not only looking at what the margins might be, but who has control next year is really going to dictate, I think, a lot of what happens at the end of this year. So, one example, it was kind of funny. I have my own little list of things to mention as potential things, and Jen rattled off all of them. The one that sort of kind of outstanding in my mind too, are in addition to a lot of the things that fell off of the user fee bill, there are also a lot of things that were kind of big priorities of President Biden and of congressional Democratic leadership that were not included in the Inflation Reduction Act. So things that the House had passed earlier. And, that's a potential that, things like trying to address the Medicaid coverage gap. I think it's probably an outside chance, but if the Republicans do take one or both chambers in the midterms, I think you could also envision the Democratic leadership might be looking at this saying, okay, we have only a few weeks to try to get some of these big priorities through because they're not going to happen in a Republican-led Congress. So I think the sort of universe of what is pursued may look a little bit different with the flip than if both chambers stay the same, and Democrats might think, oh, we have next 2 years to try to accomplish some of these things as well.
And one of you, so another term that was used here, and I don't want to assume that everybody watching and listening and leading advocacy efforts in their communities knows all the terminology. Lame duck. What is a lame duck? And then sometimes we even say, we don't know if we're gonna have a lame duck or a lame duck. I've heard that term used a lot recently. Can somebody just say, define what a lame duck session is for those who are listening today?
Lame duck session is the members who are voting may not be the members who you voted back in for next Congress. So you have the current Congress that was elected 2 years ago on the House side. Obviously, Senate is different, but many of the members voting could have been voted out of office. So that's why the term lame duck.
Great. Thank you, Cheryl. Okay, so we've already sort of gone into this a little bit, but I'm interested in, so we've talked about what we think Congress is going to be. Well, we don't know what Congress is going to prioritize, but we know that there are all these different issues that are priorities. And Cheryl started to talk about how different election outcomes could impact the overall context and landscape. I'm interested in how different election outcomes could impact the constituencies that you specifically work with and the rare disease community. And you're all here because you have vested interest in the rare disease community. So could you talk a little bit about some of the lenses through which you look? And Jen started and Eric followed with a nice list of some of those priorities, but can we talk a little bit about the rare disease priorities through the end of 2022, how they could be impacted by some of the election impact and a lame duck? And I just also want to flag, when Jen was talking about Cures 2.0, the Rare Disease Center of Excellence is also in Cures 2.0, so that's something else that's in there. And then your various different constituencies. And I'm going to have Darren start with this one, if you want to get us started off, Darren.
Sure. I tend to operate under the assumption that the pundits may be right here, that the House will flip to the Republicans, and by who knows what the margin is. Most say that it may just be slim, and that the Senate will remain with the Democrats, also by a very slim margin, maybe 51 votes at most. It looks to me. So I think we're going to have those two balancing themselves out, which will create an interesting dynamic if we can get people to negotiate and not talk past each other. What does that mean for some of our priorities? I think, and Jen alluded to this already, I think budget watching is going to be a big thing with Republicans. So budget, and money. So some of the policies that may be too costly, I think we're going to have a hard time fighting for those. I do think that many of the policies that I would put in the unfinished business category, things that fell off of the UFAs especially, and especially the telehealth stuff, from what I've been hearing from all the circles, and yes, this was me advocating for the Rare Disease Diversity Coalition and some of the other rare diseases, these guys were apologetically saying, we're really planning on pushing this in the lame duck. Mm-hmm. Again, if their dynamic changes, I'm talking to Republicans and Democrats in the Senate, but if leadership changes and there's a lot more budget hawking, I'm not sure how I see that playing out. I'd love to hear what Cheryl would have to say about that.
Well, can I ask, before Cheryl tags in, can I ask a follow-up question, and then maybe Cheryl can tag into the follow-up also? And because I know a lot of our communities, and especially Darren, and then Eric, you guys were really a part of helping lead a lot of charges around provisions around health equity issues, especially around clinical trial diversity. And that was one of the provisions in the user fee agreement that fell off, just in the context of, and telehealth is certainly absolutely a priority of the rare disease community also. So we do want to see that move forward. But where do you see the clinical trial diversity issues fitting in within the context of the coming weeks, or do you?
No, well, I do. We saw that it passed. A lot of that passed with those riders in the House bill in a bipartisan basis.
Yeah.
Mind you, with co-sponsors, Republican co-sponsors, and strong Republican support. But in the Senate, we saw it fade off. But part of that was some of this standoff with the ranking Republican on the Senate Health Committee. What I have been hearing, and this goes back to something Jen said as well, is that many of the folks in the Senate consider this a bit of a two-step, because they're still pressing for the Prevents Pandemic Act, which did have many diversity in clinical trials provisions, and although it didn't have the have some of the stronger provisions with the diversity action plans and things of that nature, but it had many diversity in clinical trials provisions that were passed in the House. They were in the Prevents Pandemic Act. So I think there are many folks there that are bipartisan are considering a two-step where they push that, and by pushing the Prevents Pandemic Act, they automatically uplift some of the diversity in clinical trials provisions.
I'm curious, the trial diversity piece of this has been really interesting to me, because there are so many members who have very different bills out there. And so I'd have to think, even if something happens this year, there's still so much space to cover within that broader area that this is still, it could be a this year, next year issue, just like what you were saying, Darren. There's so many people who have their own ideas on how to address this, and they're all very different, which is a good thing. It's just there's a lot out there, a lot to pick from, which I hope that this is something that is on the agenda for next year, regardless of who is controlling the various committees.
And
I think our community can feel blessed by the fact that there's so much interest, even though the ideas are so divergent. So that what that tells all of you out there, advocates, is, engage, speak to your representatives, act in a concerted manner with some of these leading organizations, and get to all of these folks and get them to find a way to compromise and get this done right.
So can we build off of that, Darren? That's a nice segue. So, for our advocates, obviously everybody has limited time, limited bandwidth. We have a long list of issues that have now sort of fallen aside, that everyone worked really hard on over the last year. And we've just said we have very limited time for engagement, because we don't have a lot of days left in 2022 to get the attention of the members. And there are going to be new members coming in to develop relationships with, which we'll talk about that in just a second. What really tactical advice would each of you have for advocates around engagement, and around sort of thinking about, with that long list, thinking about how to prioritize which of those items to move to sort of the top of the list for 2022 versus what to maybe move to the 2023 considerations? So I'll just open that up.
Couple things that I would mention on a clinical trial diversity. I'll just with the same disclaimer that Jen gave about don't take any notes on this. It's going to happen. I think just with the amount, that's the overwhelming bipartisanship that we saw in the House on it. Like, I feel very confident that, and I hope it happens this Congress, but next Congress for sure. With that said, I think a couple pieces of advice would be: one, get those items in ASAP. I noticed from a number of offices that we're meeting with, they're kind of going through that process of figuring out what their list of priorities are so they can give those to leadership. With that said, they're going to be a little bit slower to get back to you these days. A lot of them are out campaigning. So certainly kind of make sure you're kind of getting that worded down. And then I would think about what are some of those things that you think are likely to be harder next year, particularly if one or both chambers flips into Republican control. Because I do think that there probably will be more of a prioritization from Democrats on what are the things that are going to be easier to do now than they will be next year. Would be one piece of advice. And I also say not only are we going to have new members, the leadership of the committees is going to look very different next year as well, regardless of who maintains control, particularly in the Senate. I think it's going to look, the health committee is going to look very different, regardless if it's Democrats or Republicans in charge.
Great suggestions. I appreciate the specificity of them too, because I think people are really looking for, what do we do? Cheryl.
So this is a little technical, but I'm going to speak to a very diverse group of patient advocates who are here on the call. If you have a policy provision that's already in one of the House or Senate versions of the FDA user fee agreement, something very, targeted. So I'm not talking, I mean, yes, the clinical trials piece is big, but a targeted provision, you are in a better situation than if a piece of legislation that has never moved. And I want to differentiate that for the crowd. For the participants, for the crowd. The legislation that has not moved in either the House or the Senate, the likelihood of your bill getting attention before the end of this Congress is very, very slim. There's just too many pieces outstanding right now. And so my advice to you is on those pieces that this is the best education time to lay the groundwork, that you want to start from where you left off in this Congress and not from scratch and the next Congress, and trying to talk to the champions of your legislation about how do we do that and how do we get some commitments from the incoming leadership from these new committees. Well, they're not new committees, but new leadership on the committees, as Eric just mentioned, that this could be as part of the agenda for next Congress. If you're getting feedback that it hasn't moved in either the House or the Senate, that is my advice to you. And I do think that there are probably some participants on this webinar that are in that space. For those of you who are not in that space, where you've got an important provision on cures or user fee agreement, and it's got some movement in either one of the chambers, I just want to throw out a couple of ideas. One, suspension calendar. If you've got a standalone bill, you should be advocating with your champion that bill have some action on the House suspension calendar before the end of the year to show progress on your legislation. Two, if it's a Senate champion, hotline. So suspension calendar in the House, and I know I'm using technical terms, but I said from the start I was going to. Suspension calendar in the House means that you need to have a bipartisan bill that 2/3 of the House will vote to pass it. Hotline in the Senate means everyone in the Senate has to say yes. So it's actually a higher threshold than the House. But it's interesting, there has been an attempt, and it was successful, to separate out an issue that was riding on the user fee agreement by one of the champions in the Senate on not rare disease community, but it was animal testing, where they hotlined it and no one blocked it and it moved. And so I just want everyone to think very creatively. How do you work with your champions to push some legislative movement for your policy ideas so that you have a marker if it's not going to be included this year into the next Congress? Because I agree absolutely with Eric and Darren, there's changes in leadership and decision-making about what the agendas will be next Congress. So it's just another tactic to try. And it also shows you too, how strong the support is for your legislation. And that sometimes can be frustrating as a patient advocate, but it's it's information, and you need to take that information and figure out what are the next steps to do with it. And so to help build support for your bill. So no, I just see no downside to trying to have those conversations with your bill champions during this time.
Cheryl, those suggestions are amazing. Also, I'm in rare disease. I'm aware of a couple instances over the decades where hotlining's been utilized to identify where the barriers might be. So where there might be opportunities to advocate. So when the bill didn't pass through the hotline, the advocacy community then had a better sense of where there were advocacy opportunities to work on those relationships. Those are great suggestions. Others?
I do want to say that I feel like we may be painting a little bit of a doom and gloom picture, and I don't know, maybe we are, but it's really important to keep in mind that regardless of who is in control of the House or the Senate, or the particular committee that you need to work with to move your bill, or even who your elected official is, maybe it's not the person you voted for. And, you know, just keep in mind that these issues that impact the rare disease community are absolutely purple. We don't have issues that are one side or the other. Everybody is impacted by rare. It doesn't matter what your political affiliation is. So don't be afraid to engage a member or committee that maybe you don't agree with politically, because I've seen it so many times that if you can find common ground on anything with any office, it is usually on issues that are impacting our community. So don't be discouraged. Just keep swimming. I'm just saying that because I say that to my kids. I dare you all to get that out of your head now too, because it is going through your heads, but you just have to keep swimming and not get thrown off by, you know, whatever the result is going to be in your, you know, local election, and then broadly in Congress, what that means.
Great reminder, Eric.
Yeah, and I just, you know, this is definitely not in my nature to look at things this optimistically, but the doom and gloom that Jen mentioned is probably more in my wheelhouse. But I will say, and maybe this is a little more Pollyannish than real, but I do believe this, that, and Darren sort of touched on this a little bit, that if we have split control of government, I think it really changes the way that Congress legislates. And in many respects, I think there could be a lot of positive impacts from that. If you know, they do have to negotiate, they do have to come up with some bipartisan solutions to a lot of very real challenges. I mean, one really good example that, you know, all of us in this group worked on was the 21st Century Cures Act. That was passed by a Republican House, a Republican Senate, and signed by President Obama. So, you know, and that was a wonderful process that the Congress went through to get to where we landed. So I do think, you know, as we look forward into 2023, I think there are some, you know, regardless of your political leanings, I think there are some positives to look forward to from having those sort of checks and balances within the government.
The other thing on the optimistic tilt, I will say, you know, we keep talking about the skinny or clean user fee package, but I will say the process for getting to that user fee package included really robust engagement with the patient community from all of those who negotiated that package itself, the trade organizations, Congress. And so that user fee package that was signed into law in the reauth reflects such robust provisions that benefit the rare disease community. And already we've seen some of those put into place with FDA. So, you know, it wasn't just the riders that had provisions that mattered to us as a rare disease community. It really is a very robust PDUFA 7 that is very beneficial and focused on the rare disease community because of the way that FDA and the trade organizations were engaging with us all throughout the process. So I'll just put that out there also. Pivoting just a little bit, as we know, everything really starts in the States and comes back to the States. So can we just talk a little bit about, are there any issues or things that we should be flagging, especially through the lens of rare, that we should be watching closely within the States? Medicaid expansion, copay accumulators, other access policies, things that maybe you guys want to flag or talk about and highlight? Darren, I saw you come off mute. You want to start?
And I could have highlighted any of those,
Okay.
but
Or talk about what they are or whatever you want to say.
I'll start. They're all coming from, well, I shouldn't say they're all. The copay thing, accumulator thing is coming from gamesmanship within the rival industries within the healthcare system. But where I was really going was, we've seen the writing on the wall in the states for years now. You've got the state budgets on a collision course or creating a collision course between some of the transformative innovation that's in the pipelines that really can make a difference in lives and meet unmet medical needs. Many of them, gene therapies, for example, for rare diseases. You've got these transformative innovation therapies coming down the pike, and you have the current system of Medicaid state agencies that are bursting at the seams with, and are one of the top 3 budget issues in every state. They're getting a lot of pressure. The system and these poor Medicaid agency directors have a system that's set up to manage chronic care treatments. It's not set up for transformative innovations that may be a one-time dose that cures, or at the very least halts progression of the disease. That's something that will call for higher upfront payments and have a different cost, benefit, and value analysis, something totally different than they're used to. I think this is set up to be a collision course because their budgets, they're already strained. They're not going to be able to absorb these, and something's going to have to give. There's going to have to be some change in the entire Medicaid system to help equip, I almost call it innovation in policy and in systems to match the innovation that's coming down the pike. Those two things, and you can see some of the almost desperate budget-led policies that have been coming out of states over the past several years, just begging for help. I think when some of these gene therapies that are looking like they're going to come off in the next couple of years do, this system's going to be tested even further, and it's got to be amended if we're going to actually have a system that cares for these patients and gets them access. It's a problem.
Amen. We're also, I'll just add, we're also seeing though in the data, and we're grateful to our partners who are doing this data collection, Ken Thorpe and PFCD, New Digs, and others who are really looking at some of the trends and the impact already in the healthcare environment of some of the innovative therapies on the Medicaid spend and the healthcare spend. And it's not having the detrimental impact that I think a lot of health insurers have been fearful of, that the impact of some of the innovative therapies on Medicaid has not been as expansive as they had anticipated. So I think from 2016 to 2020, it was less than 1% of the Medicaid budget was impacted by accelerated approval therapies. There's been some modeling done to look at what's in the pipeline through 2030 to see how cell and gene therapies would impact the healthcare environment. It also showed that it was much less than the health insurers were anticipating. But to your point, Darren, we do need better models for insuring families because the policies that are being prepared with lasering and copay maximizers and copay accumulators and these utilization management techniques are unethical and are really creating roadblocks and hurdles and timelines for access that are extremely detrimental and have horrible consequences for families living with rare disease therapies. So we do have to do better.
Can I just flag, because Darren really raised a big issue that's bigger than our community, but Congress, because of the pandemic and other issues, has doled out so much money that the size of the deficit is huge, and the debt ceiling is something that will have to be raised next Congress. It makes it far more complicated because you tend to use what's called mandatory spending. So like Medicaid dollars, Medicare dollars, Social Security dollars to offset the debt that the United States has accumulated. That's where you tend to see, and it was budget reconciliation that the Democrat majority used twice to change some of those mandatory spending programs during the pandemic, and also this last vote on the inflation, so-called Inflation Reduction Act. That those types of policies, we're going to see some action on that. And there is an interesting dynamic going on, whereas I 100% agree with Darren, Medicaid continues to take a huge portion of state budgets, but state budgets are also flush with cash right now between infrastructure bill and COVID payments from the federal government. And so how you rebalance out some of those state budget priorities is a much bigger conversation in this next Congress. And what is really striking to me is we used to talk about programs being hundreds of millions of dollars. Now we're talking billions and trillions. And that is a huge change in how we talk about the federal budget. Huge change. And then I just want to raise this because I do think it's important and will impact us. Healthcare costs have not gone down over the past decade. They continue to rise, inflation only making it worse. The issues that Annie's mentioned on like copay accumulators and how do you, the system as it's currently designed, how do they squeeze savings so often can impact us in the rare disease community. And that's something that we have to stay on guard about to make sure that in squeezing in order to quote, reduce healthcare costs in the aggregate, that we're not somehow squeezing out the space that we need for the rare disease community and some of our innovation and crisis needs, especially with gene therapy still needing to be properly authorized and adopted into the Medicaid program. So I just throw that out there. Big picture.
And commenting on one point that Cheryl made about sort of how state budgets are looking these days with a lot of the infusion of cash from the COVID relief bills. Let's not forget that the end of the public health emergency is likely to happen in the next sometime within the next few months. And with that means that a lot of the additional funding that was going to the states for their Medicaid programs will no longer be going, and states will have to make the determination about sort of what happens with folks who are no longer eligible for Medicaid and looking for other insurance programs for them. So do want to flag that as something I think is incredibly important. Also on Medicaid front, if you or a loved one happens to live in South Dakota, Medicaid expansion is on the ballot this year. It's likely to be the last time we see a ballot initiative on this, just based on how many states are left and how many of them actually have ballot initiatives. So it's incredibly important that folks weigh in there. And just generally speaking, that you kind of go all the way down through your ballot and think about your state and local elections, because they, in many respects, have a much bigger, in a lot of cases, have a much bigger impact on your lives. So, really give that some thought as we think about heading into November 8th, sort of who you want to represent you, not only in Washington, but in your state house and locally as well.
I just want to, for Medicaid expansion, one of the reasons why that is so important to the rare disease community, I'm sure I'm preaching to the choir here of those listening, but our rare disease community is highly Medicaid eligible because many of our community members are eligible for Medicaid through the various different waivers in the state, through the various different TEFRA or disability waivers. So this is a really high priority for the rare disease community that members of the community be eligible for Medicaid. Many of the health benefits, caregiver benefits, pharmaceutical benefits are only available through the Medicaid programs, rather than even if you have a commercial health plan in addition to Medicaid, coverage is often through your Medicaid program. So just want to add a little additional context for that, in addition to those who only receive their health insurance through Medicaid. We have a question that came in through the chat that I think is or through the Q&A that I think is a great question. So the question is around whether or not there are any existing initiatives to tier the term rare, as in more incentives for therapeutics to diseases that are often rarer than others. So I think this really refers to defining ultra rare in statute. I don't know if anyone here wants to field it. I can tag in, but anyone want to? What I can say is ultra rare has never been defined in statutory language. We do see it creep up and pop up sometimes. It actually came up this year in legislation. It has been defined by ICER has defined it. There are different definitions outside of the US. There is an interest from some of our partners to convene, and Every Life will probably be thinking about convening a workshop this coming year around pulling together a lot of leaders in the space to think about whether or not ultra rare should have some type of definition, and whether it's a numeric cutoff or whether it's different types of characterizations of a community that would be what we would use to qualify what ultra rare is before we go to define it in statute. I will say that altitude, which is a provision of the Stat Act, does talk about ultra rare disease, but we were really careful when we crafted that language with our congressional leadership and with those who wrote the bill to do it in such a way that we weren't defining ultra rare in statute, but there are incentives within that legislation that would have additional resources through FDA for the rare diseases. So there are some initiatives underway to really recognize that there are some rare diseases that need some additional resources. And there's a lot of work at NCATS and other areas of our federal agencies that are really looking to ensure that the rare of the rare diseases do benefit from the innovations that are underway. But just to say that we have never defined ultra in statute, and we have never come to a consensus on how you would define that cutoff yet. So I don't know if anyone else wants to weigh in on that. But. Okay. All right, we're getting close to time. So I think I'm just gonna end with one question. If you were a member of a rare disease community and you had the ability to sort of send out messaging to your partners, to the advocates with whom you work, where would you be looking for resources? Where are the trusted sources of information in the coming weeks? There's a lot of messaging coming at everybody around elections and campaigns. But where are you looking to for information? Who are you relying on?
Every Life Foundation, Annie.
That was not intended to be a shameless plug. When we're not putting out political information, by the way, but RDLA is certainly a good information from reaching members of Congress. But just to be tracking what's happening, are there any places that people can be following?
Let me jump in with this, because I will say that there's a lot of information out there. Some of it is good, some of it is not great. We've been sorting through a lot of it at my firm. And so actually, I'll talk to Annie about this, but we have a political report that we just wrote that I'm happy to share with people on the call. And then also we will be walking through the election results after the election, and people are more than welcome to use the resources that we put out. I think they're pretty good. I wouldn't work at a firm that put out garbage, but it's a good question, because I feel like it's difficult to trust some of the polling, because it's, obviously you can get whatever result you're looking to get. So be cautious with where you're looking for your information, but I would look to the foundation certainly for reliable and accurate information. And then just a quick plug and a reminder that I didn't touch on yet, but with the new Congress means that there will be members who fall off of the Rare Disease Congressional Caucus and new ones to approach for the caucus. And so as you're thinking about doing outreach to whoever your member might be, especially if they're new and they're not involved with the caucus, a great way to just do some very basic outreach to the new office, just to get your name out there is to mention the caucus and ask them to join. And the foundation and RDLA has resources for those discussions, but be careful with what you're looking at and turn off the 24-hour news cycle because it will give you anxiety.
That's all great advice. And I should also say, we sort of build this webinar as we were going to talk about the end of 2022 and the outlook for the beginning of 2023. And about half an hour in, I abandoned, we're not going to even talk about 2023. So we reserve the right to invite you all back in mid-November and maybe have a webinar saying, now what? So, but thank you. That was great advice. Anybody have anything to add to what Jen just shared? I can't believe. Okay. So can we pull up, Alyssa, can we pull up the slides? Well, so first of all, I just want to thank all of our panelists. This was really fun for me personally. So it would be fun to have you all back actually for our next webinar, which I'm going to actually share the date. And if it doesn't work for these guys, maybe we'll have to move it because it would be great to have everybody back to say now what after the elections and when the, new members are moving into their offices and finding out where their bathroom keys are. We could then be talking about how to engage and meet them and turn them into our champions. I do want to remind everybody who's on today that we have travel reimbursements for Rare Disease Week, and Rare Disease Week is in person this year, the first week of March, and we would love for you to be in Washington with us to be meeting the new members of Congress and those who are back again. So these are the states that we do not have many applicants for travel reimbursements from. So if you or your loved ones or friends are from these states, please encourage them to join us and apply for travel reimbursement. Next slide. Our next webinar will be November 17th. At noon, and it may be via a conversation much like this, but now we'll know. And we won't have people have to pull out their crystal balls. We'll be able to really talk about where we are and what's happened and what the actual next couple of weeks look like and what 2023 will look like. So next slide, Alyssa. And this is how to keep in touch with us. And if you'd like to keep in touch with any of our presenters today, I'm sure everybody's on LinkedIn, or we can help you reach out to everybody. And I would just end with a big thank you to our colleagues and panelists for what you do every day on behalf of our community, and especially for joining us here today. And then a reminder to everybody who's with us today from our rare disease community, a thank you to you for what you do every day. And we're just really proud to work with you. Fasten your seatbelts. It's going to be an exciting couple weeks. And somebody reminded me the other day that the only person who gets hurt on a roller coaster is the person who gets off mid-ride. So we're in this together. We're going to really have an exciting couple weeks. And don't forget to vote on November 8th. So thank you, everybody, for joining us. Have a wonderful rest of your day. Thank you.